Texas Live on KETK. Well, as the temperatures start to rise, it's time to start thinking about safety in the sun.
And joining us to talk about this is Kelly Cox from ETMC's Air 1. Thanks for coming on, Mr. Cox. So tell me, temperatures are starting to heat up. People are starting to go out and enjoy the summer. What are some things they should remember to prevent any illness?
One of the main things they need to remember is pre-planning. A lot of people forget to pre-hydrate the night before. If they're anticipating an exertional day or a hot day that they're going to experience, they really need to pre-hydrate, and not just with just water. Electrolytes are very important.
Yeah.
Sometimes we drink a lot of water, but we forget the electrolytes.
Yeah. So how much water should people be drinking throughout the day if they know they're going to be out in the sun?
It really depends on their exertional status. You need to pay attention to your heart rate. If your heart rate starts to speed up, that's a sign that you may be low on water. Additionally, the big thing is when you start to have dry mouth or you're not sweating as much as you were earlier. Those are the keys. There's not really a set number because you can actually have water intoxication, which is too much water. And sometimes we see that in the urgent cares in the emergency rooms.
Yeah.
Let's talk about severe sunburns. You know, at what point should you probably go see a doctor or severe sunburns? Are they being able to treat at home? Well,
basically the clinical definition of a second-degree burn is a burn that is basically through the full dermal layer that's causing blistering, open wounds, things like that. Anytime that occurs, especially over a larger surface area, like their back or a full arm, that probably needs to be seen because your risk for infection is raised significantly. That's something that a lot of times urgent care would be able to take care of. It's not something necessarily that you would need to go to the emergency room for, but urgent care or a lot of times your primary care provider can take care of that.
Well, with sunscreen, what is the SPF that you all recommend? And there's always, this debate back and forth about how early you should put that sunscreen on before you go outside or before you get in the water.
Right. Biggest thing is read the instructions. That's one thing that a lot of us don't do, is there's 1,000 brands of sunscreen out there, but very few of us read the instructions. So pay attention to the instructions, look at the SPF, usually higher for myself, fair skin, but even with darker skin, you need to have a pretty high SPF. I recommend at least 20.
At least 20, okay.
You brought up emergency rooms and urgent care. At what point should you go to an emergency room?
Well, and this is a debate statewide. Because of the advent of the freestanding emergency room, a lot of people, a lot of citizens are confused as to what they really are. A freestanding emergency room is exactly that. You will receive an emergency room bill. So an urgent care is billed more like a clinic. And so that's what it is. But it's in between, as far as treatment-wise, your primary care provider. We can provide fluids, we can sew up lacerations, urgent cares are more for that in between. Not necessarily a significant event, but if you lose consciousness or if you have severe muscle aches, the worst thing about heat exhaustion or heat stroke is a condition called rhabdomyolysis, where the muscles actually break down so far that they can actually cause kidney failure. In case, if you have that situation go on, you definitely need to be in an emergency room because it is a life-threatening.
All right. Well, thank you very much, Mr. Cox, for coming on and
thank you for
giving
having
us these tips.
Thank you very much.